Why do you want to be an operating room nurse?
I am interested in becoming an operating room nurse because I thrive in a high-acuity, fast-paced environment that demands precision and critical thinking. The OR is a unique setting where I can apply my clinical skills to directly assist surgeons and contribute to life-changing patient outcomes. I am particularly drawn to the collaborative nature of the surgical team. I understand that a successful surgery is a result of meticulous teamwork and clear communication, and I am confident in my ability to be a reliable and proactive member of that team. My passion for patient advocacy is another key reason for my interest. In the operating room, I would serve as the patient's voice and protector, ensuring their safety and well-being when they are most vulnerable. I would be responsible for tasks like verifying surgical sites, maintaining a sterile environment, and continuously monitoring the patient's status. This level of responsibility is something I find both challenging and deeply rewarding. I'm also eager to expand my technical skills and knowledge of surgical procedures and equipment. I have a strong attention to detail, which I believe is essential for anticipating the surgeon's needs and ensuring the seamless flow of an operation. Ultimately, I want to be an OR nurse because I am passionate about the specialized, high-stakes care provided in this setting. It is a role where I can utilize my skills in a dynamic environment, contribute to patient safety and positive outcomes, and work as an essential part of a dedicated team. I am committed to continuous learning and believe this is the ideal specialty for me to grow both professionally and personally.
Describe your experience with scrub and circulator roles.
In my nursing experience, I have developed proficiency in both the scrub and circulator roles within the operating room. My experience as a scrub nurse involved maintaining the sterile field, meticulously preparing and organizing instruments, and anticipating the surgeon's needs before they even asked for them. This requires a high degree of focus and a deep understanding of the surgical procedure. For instance, in a recent orthopedic case, I was able to have the necessary screws and drill bits ready for the surgeon, ensuring the procedure flowed smoothly and efficiently without any delays. This role has honed my attention to detail and ability to work precisely under pressure. As a circulator nurse, my responsibilities shifted to managing the overall surgical environment and acting as the patient's advocate. My duties included conducting the preoperative verification process, ensuring all equipment was functional and accounted for, and documenting every aspect of the procedure. For example, during a general surgery case, I was responsible for monitoring the patient's vital signs, positioning them correctly on the operating table, and managing fluid and blood loss. This role requires excellent communication skills and the ability to think quickly to address any issues that arise. It also gave me a holistic view of the surgical process, from the patient's arrival to their transfer to the post-anesthesia care unit. I am confident in my ability to perform both roles effectively and to transition between them as needed. This dual expertise allows me to support the entire surgical team and ensures the highest level of patient safety and care. I understand that the success of a surgical procedure depends on the seamless coordination between all team members, and I am committed to contributing to that cohesion. My experience in both roles has provided me with a comprehensive understanding of the OR.
How do you prepare the operating room for a surgical procedure?
My preparation of the operating room for a surgical procedure is a meticulous and systematic process designed to ensure a safe and efficient environment for both the patient and the surgical team. I begin by thoroughly reviewing the patient's chart, paying close attention to their medical history, allergies, and the surgical consent form. This is a critical first step as it allows me to anticipate any specific needs or potential risks. After that, I check the surgical schedule and confirm the required equipment and instruments. I then begin to gather everything, ensuring all necessary supplies, including gowns, gloves, and drapes, are sterile and accounted for. A key part of the preparation involves a comprehensive equipment check. I personally verify that all machines, such as the anesthesia machine, suction, and electrocautery devices, are fully functional and in their correct positions. I would never assume a machine is ready without checking it myself. I then proceed to open the sterile instrument trays and set up the surgical field. This involves arranging the instruments in a logical order that anticipates the flow of the procedure, allowing the surgeon to work without unnecessary delays. Finally, just before the patient enters the room, I coordinate with the rest of the team to perform a final safety check. We confirm that the patient's name, the correct surgical site, and the procedure are all in alignment. This entire process, from chart review to final check, is what allows me to create a safe, organized, and effective environment for the surgery. I believe that a well-prepared or is the foundation of a successful operation.
What is your experience with different types of surgical procedures?
I have experience assisting in a variety of surgical procedures across different specialties, which has given me a comprehensive understanding of diverse protocols and patient needs. My background includes a strong foundation in general surgery, where I have assisted with common procedures like appendectomies, cholecystectomies, and hernia repairs. This experience has taught me the importance of meticulous preparation and quick, decisive action in a wide range of situations. In addition to general surgery, I have a solid understanding of orthopedic procedures. I have supported surgeons in joint replacements, fracture repairs, and arthroscopic surgeries. This has familiarized me with specialized instruments and the critical need for precision and sterile technique to prevent postoperative infections and complications. I'm also comfortable with the specific patient positioning and safety measures required for these procedures. Furthermore, I have gained experience in assisting with neurosurgery. In this area, I have been involved in procedures such as craniotomies and laminectomies. This work has highlighted the paramount importance of strict sterile protocols, continuous patient monitoring, and clear, quiet communication with the surgical team. My exposure to these different surgical fields has made me highly adaptable and confident in my ability to learn and master new techniques quickly. I am comfortable with the specific demands of each specialty, from managing complex equipment to anticipating the unique needs of different surgeons. This broad experience allows me to be a versatile and effective member of any operating room team.
How do you ensure a patient's safety in the OR?
Ensuring a patient's safety in the operating room is my top priority, and I achieve this through a series of meticulous, multi-layered checks and continuous vigilance. My process begins long before the patient even enters the room with a thorough review of their medical record. I scrutinize their allergies, medical history, and the physician's orders to identify any potential risks. I also confirm that the consent form is fully completed and signed. Once the patient is in the preoperative area, I perform a second hands-on verification. I confirm their identity using at least 2 unique identifiers and visually mark the surgical site to prevent any wrong site procedures. This crucial step is then re-verified by the entire surgical team during the surgical timeout. During this formal pause, we all verbally confirm the patient's identity, the surgical procedure, and the correct site. Throughout the surgery, my vigilance continues. As a circulator, I continuously monitor the patient's vital signs, fluid balance, and skin integrity to prevent pressure injuries. I also manage the surgical environment, ensuring that all equipment is functioning correctly and that there are no hazards on the floor. If I am in the scrub role, my focus is on maintaining an impeccable sterile field to prevent infection. I am meticulous about my technique and would immediately speak up if I suspected any breach in sterility. I understand that patient safety is not a single action but a continuous process of checking, rechecking, and advocating for the patient at every single step. This proactive and systematic approach is how I ensure their safety from the moment they arrive until they are safely transferred to the recovery room.
Explain the surgical timeout and its importance.
The surgical timeout is a critical safety check performed by the entire surgical team immediately before a surgical procedure begins. It's a mandatory final pause where everyone on the team, the surgeon, the anesthesiologist, and the nurses stops what they are doing to verbally confirm essential details. During this moment, we all agree on 3 key things: the correct patient, the correct surgical site, and the correct procedure. This is a last line of defense against surgical errors. The importance of the timeout cannot be overstated. It is a systematic process designed to prevent serious and preventable mistakes, such as operating on the wrong patient or the wrong body part. These never events are completely avoidable, and the timeout is the most effective tool we have to prevent them. It ensures that everyone on the team is aligned and has a shared understanding of the plan. This moment of collective verification forces a double check of the patient's identity and the details of the operation against the patient's medical records and consent form. It also allows any team member, regardless of their position, to voice a concern if something seems incorrect, promoting a culture of safety and open communication. It transforms a surgical plan from a document into a shared, confirmed reality for the entire team, making it a cornerstone of patient safety in the operating room.
How do you maintain a sterile field during surgery?
Maintaining a sterile field during surgery is a continuous process that is fundamental to preventing surgical site infections and ensuring patient safety. It begins well before the first incision, with meticulous preparation and strict adherence to a series of protocols. The first step is my own surgical scrub, followed by proper sterile gowning and gloving technique. From that point on, my actions are all aimed at protecting the integrity of the sterile area. Once the sterile field is established, I remain hypervigilant. I am always conscious of where my hands are and what they are touching. I avoid reaching over the sterile field whenever possible, as this can lead to accidental contamination from particles in the air or from my own non-sterile areas. If I need to move around the operating room, I do so in a way that protects the sterile field from the non-sterile environment. I also keep my movements deliberate and controlled to avoid accidental contact with any non-sterile surfaces or people. For example, if I need to pass a sterile instrument, I ensure I present it in a way that the surgeon can take it without touching my non-sterile gown. I constantly monitor the sterile field for any potential breaches. This includes watching for rips in the drapes, ensuring that sterile instruments don't touch non-sterile surfaces, and keeping an eye on the entire surgical team. If I suspect a breach has occurred, my immediate priority is to voice my concern to the team. By speaking up clearly and calmly, we can address the issue immediately by replacing or re-sterilizing any compromised items. This proactive and unwavering commitment to sterile technique is essential for a successful surgical outcome.
What steps do you take if a sterile field is compromised?
If a sterile field is compromised, my first and most important step is to immediately vocalize the breach to the entire surgical team. This is a crucial safety measure to ensure that everyone is aware of the situation and can act quickly. I would say something clear and direct, like, "I believe the sterile field has been breached." There is no room for hesitation or uncertainty in this situation. My next action would be to stop the procedure if the breach poses an immediate risk to the patient. Once the breach is identified, I would assist the team in managing the situation. This involves taking contaminated items off the sterile field and having them replaced with new sterile ones. I am trained to understand that even the smallest breach can lead to a serious infection, so there is no such thing as a minor compromise. After the contaminated items are removed, I would help the team re-establish a sterile environment to continue the procedure safely. This might involve setting up a new sterile instrument tray or replacing contaminated drapes. Following the procedure, I would take the time to meticulously document the incident. This includes noting the time of the breach, the specific items that were compromised, and the actions we took to rectify the situation. This documentation is essential for quality assurance and for maintaining a comprehensive record of the patient's care. My priority in such a situation is to act quickly, communicate clearly, and ensure that patient safety is never jeopardized.
Describe your experience with surgical equipment and instruments.
I have extensive experience with a wide array of surgical equipment and instruments, which is a result of my work in various surgical specialties. I am proficient in the identification, handling, and maintenance of numerous tools, from basic surgical sets to highly specialized instruments. My knowledge includes common surgical tools like scalpels, forceps, and retractors, as well as more complex devices. I am comfortable with electrocautery devices and understand how to manage their settings and ensure patient safety by correctly applying the grounding pad. My experience also includes working with advanced technology, such as laparoscopic equipment for minimally invasive surgeries. I understand how to prepare and troubleshoot the camera, light source, and insufflation machine to maintain a clear visual field for the surgeon. Furthermore, I have experience with surgical lasers and the specific safety protocols required for their use, including the use of protective eyewear and masks. I believe my ability to anticipate a surgeon's needs is directly linked to my intimate knowledge of these instruments. I know which instruments are typically used for each stage of a procedure, which allows me to have them ready before the surgeon even asks. I'm also skilled in recognizing when an instrument or piece of equipment is not functioning correctly. For example, if a suction tube is not working effectively, I can quickly replace it without disrupting the flow of the surgery. My comprehensive understanding of surgical equipment and instruments allows me to contribute to a safe and efficient operating room environment.
How do you handle a sudden change in a patient's condition during surgery?
During surgery, if there's a sudden change in a patient's condition, my immediate response is to remain calm and notify the rest of the surgical team. I would immediately inform the surgeon and the anesthesia provider of the change in a clear and concise manner. For example, if I notice a sudden drop in a patient's oxygen saturation, I would say, "Anesthesia, the patient's SpO2 is dropping to 88%. This prompt, direct communication is crucial because it allows the rest of the team to take immediate action. After alerting the team, my next step is to assist as directed. My training has prepared me to act quickly and effectively under pressure, whether that means preparing for an emergency, providing necessary equipment, or assisting with CPR. For instance, if the surgeon needs a specific instrument or the anesthesiologist needs a piece of airway equipment, I would have it ready immediately. I also remain a vigilant observer, continuously monitoring the patient's condition and the surgical field for any other changes. My role is to be an extra set of eyes and hands, ready to support my colleagues as they manage the crisis. Finally, I would meticulously document the entire event, including the time the change occurred, the interventions taken by the team, and the patient's response. This documentation is vital for the patient's record and for a later review of the case. In such high-pressure situations, my ability to stay composed, communicate clearly, and support my team is what allows us to effectively manage the situation and ensure the best possible outcome for the patient.
How do you communicate with a surgeon during a procedure?
Effective communication with a surgeon during a procedure is paramount, and my approach is always centered on being clear, concise, and anticipatory. I believe that successful communication in the operating room is less about talking and more about anticipating needs and speaking only when necessary. Before the procedure even begins, I make it a point to review the surgical plan thoroughly so that I have a clear understanding of the steps and the instruments that will be required. During the surgery, I primarily communicate nonverbally through my actions. By observing the surgical field and the surgeon's movements, I can often anticipate their needs before they ask. For example, if I see the surgeon about to make an incision, I will have the scalpel ready to be passed to them. When verbal communication is required, I use precise, professional language. If I'm asked for an instrument, I will confirm the request by saying the name of the instrument clearly. If I have a safety concern, I will voice it directly and calmly. For instance, "Surgeon, please note that the field is compromised." I also recognize that a surgeon's focus is on the patient, and my role is to facilitate that focus. I avoid unnecessary chatter and ensure that any information I provide is relevant and to the point. My communication style is designed to create a seamless and efficient workflow, minimizing any distractions that could compromise patient safety. My ability to communicate effectively, both verbally and non-verbally, is a key reason I am a valuable member of a surgical team.
Describe a time you had a disagreement with a member of the surgical team. How did you resolve it?
I can recall a situation where I had a disagreement with a surgical tech regarding the arrangement of instruments on the sterile field. During a complex orthopedic procedure, the tech wanted to place a large instrument tray in a position that, in my opinion, obstructed the surgeon's direct access to the patient, could potentially compromise the sterile field. My primary concern was patient safety and the efficiency of the procedure. Rather than escalating the issue, I approached it calmly and professionally. I quietly pulled the tech aside and explained my concern. I didn't frame it as a personal disagreement, but as a shared problem we needed to solve for the benefit of the patient and the team. I explained that having the tray closer to the patient would not only make it easier for the surgeon to access instruments, but would also reduce the risk of someone accidentally bumping into the tray or reaching across the sterile field. The tech listened to my reasoning and appreciated the focus on patient safety. After a brief discussion, we worked together to find a solution. We rearranged the instrument tray and moved some equipment to create a more efficient and safer setup. The surgeon later commented on how well organized the room was. This experience reinforced the importance of clear, respectful communication in a high-stakes environment. I learned that by prioritizing patient safety and the team's shared goal, disagreements can be resolved quickly and collaboratively, strengthening the team rather than creating conflict.
How do you manage stress and pressure in a high-stakes environment like the OR?
I manage stress and pressure in a high-stakes environment like the operating room by relying on a combination of mental preparation, meticulous organization, and a commitment to teamwork. I believe the most effective way to handle pressure is to be as prepared as possible. Before any procedure, I take the time to review the patient's chart, understand the surgical plan, and ensure all necessary equipment is ready and functional. This proactive approach minimizes the chances of unexpected issues arising and allows me to feel confident and in control from the very beginning. During the procedure, I maintain a calm and focused demeanor by concentrating on the task at hand. I consciously avoid allowing myself to be distracted by the pressure of the moment. Instead, I channel my energy into maintaining the sterile field, anticipating the surgeon's needs, and continuously monitoring the patient. I also rely on clear, concise communication with my colleagues. A well-functioning surgical team acts as a single unit, and knowing that I can depend on my fellow nurses and the rest of the team to do their jobs effectively reduces my personal stress. If a sudden emergency were to occur, my training has prepared me to act quickly and decisively. My focus in those situations would be on assisting the team and ensuring the patient's safety, rather than on my own emotions. Ultimately, by combining thorough preparation with a focus on teamwork and a disciplined mindset, I can perform effectively under pressure and contribute to a safe and successful surgical outcome.
What role does a circulator play in patient advocacy?
The circulator nurse serves as the patient's most important advocate in the operating room, acting as their voice and guardian when they are at their most vulnerable. This advocacy begins before the surgery and continues until the patient is safely in the recovery room. Before the procedure even begins, the circulator is responsible for ensuring the correct patient and procedure. This involves meticulously reviewing the patient's chart, verifying their identity using multiple identifiers, and ensuring the surgical consent is complete and accurate. This critical attention to detail is the first line of defense against errors. During the surgery, the circulator's role as an advocate continues. They are responsible for monitoring the patient's physical safety, which includes checking their positioning on the operating table to prevent nerve damage or pressure injuries. They also manage the surgical environment, ensuring that all equipment is functioning correctly and that the room remains a safe space. A crucial part of this role is the surgical timeout, where the circulator leads the final verification to confirm the correct patient, site, and procedure with the entire surgical team. If I ever noticed a discrepancy or a potential safety issue, I would immediately speak up, regardless of my position. I understand that the circulator is the patient's voice when they are sedated or anesthetized, so there is an ethical and professional duty to protect them. Ultimately, the circulator's advocacy is continuous and multifaceted. It involves ensuring physical safety, preserving dignity, and acting as a final line of defense against errors. This is the part of the role I find most rewarding, as I am directly responsible for the patient's well-being from the moment they arrive until they are safely transferred to the recovery room.
How do you handle a disagreement with a surgeon?
My approach to handling a disagreement with a surgeon is guided by a strong commitment to patient safety and professionalism. I understand that in a high-stakes environment like the operating room, calm and clear communication is paramount. If I were to have a disagreement with a surgeon, especially on a matter I believed impacted patient safety, my first step would be to calmly and respectfully voice my concern. I would state my observation and reasoning clearly, providing the specific facts as I understand them. For instance, I might say, "Dr. Lee, I'm concerned about the placement of the electrocautery grounding pad. My understanding of the protocol is that we should place it on a large muscle mass, which helps prevent a burn injury." This approach focuses on the issue at hand and avoids making it a personal conflict. I recognize that the surgeon has the ultimate authority and expertise, but as a nurse, I have a professional and ethical duty to be the patient's advocate. If the disagreement pertained to a critical safety issue and I felt my concern was not being heard, I would follow my hospital's established chain of command. This would mean calmly escalating the issue to my charge nurse or a surgical unit manager. This is not about being insubordinate. It's about adhering to a professional obligation to protect the patient. I believe that a healthy professional relationship is built on mutual respect and trust. By communicating my concerns professionally and backing them up with facts and protocol, I can ensure that we work together to achieve the best possible outcome for the patient, even when we have a difference of opinion.
Tell me about a time you made a mistake in the OR. How did you handle it?
Everyone makes mistakes. What truly matters is how they're handled. I recall a time when I was assisting in a minor surgical procedure and accidentally dropped a sterile glove while preparing the instrument table. This seemingly small error could have had serious consequences if not addressed immediately, as it compromised the integrity of the sterile field. My immediate reaction was not to panic or hide the mistake, but to take full responsibility and rectify it without delay. I stopped what I was doing immediately and calmly vocalized the error to the rest of the surgical team by stating, "I've compromised a sterile glove." This quick and clear communication was crucial. After alerting the team, I stepped away from the sterile field and followed the proper procedure for regloving and re-entering the sterile zone. We replaced any items that may have been affected and confirmed that the sterile field was fully restored before the procedure continued. Following the surgery, I took the time to reflect on what happened. I realized that in my haste, I hadn't been as deliberate with my movements as I should have been. I used this experience as a learning opportunity to reinforce my commitment to meticulous technique, even in routine procedures. I also documented the incident as per hospital protocol. This experience taught me that in the operating room, honesty and transparency are paramount. Admitting a mistake immediately is not a sign of weakness. It's a mark of a professional who prioritizes patient safety above all else. This approach ensures that a small error never becomes a major risk.
How would you handle a situation where a patient's family member requests information about the surgery?
Handling a request for patient information from a family member requires a compassionate approach while strictly adhering to patient confidentiality. My first step would be to acknowledge the family member's concern with empathy and politeness. I would let them know that I understand their worry and that they are in the right place to get an update. However, due to patient privacy laws and hospital policy, I am unable to share any specific medical or surgical details directly. I would then explain that all information regarding the surgery and the patient's condition must come directly from the surgeon. I would reassure them that the surgeon will speak with them as soon as the procedure is completed and the patient is stable in the recovery room. I would also ask for the family member's contact information so that I can inform the surgeon that they are waiting for an update. By doing this, I am respecting the family's need for information while protecting the patient's privacy. After my interaction, I would immediately notify the surgeon that the patient's family is present and waiting for a debriefing. This ensures that the surgeon is aware of the situation and can prioritize speaking with a family member as soon as they are available. In this situation, it is crucial to balance professionalism and compassion. My role is to be a supportive and clear point of contact for the family while never compromising patient confidentiality. This approach helps maintain trust and ensures that all communication is handled through the proper channels.
What do you do to stay updated on new surgical techniques and technologies?
I believe that a commitment to continuous learning is fundamental for any nurse, especially in a dynamic environment like the operating room. To stay updated on new surgical techniques and technologies, I rely on a combination of formal and informal learning methods. I regularly read peer-reviewed medical journals and publications from professional organizations, such as the Association of Perioperative Registered Nurses. This helps me stay informed about the latest research, best practices, and advancements in surgical procedures. I also attend professional development seminars and webinars whenever possible. These events provide a valuable opportunity to learn from experts, network with colleagues, and gain hands-on experience with new equipment. In addition to formal education, I am proactive in my daily practice. I take the initiative to learn from my more experienced colleagues and the surgeons I work with. I'm not afraid to ask questions about a new technique or a piece of equipment I haven't used before. I also make it a point to study the manufacturer's guidelines and manuals for any new technology that is introduced to the OR. For example, when a new type of surgical robot was brought in, I spent time observing its use and reviewing its technical specifications to ensure I understood how to assist effectively and safely. This blend of self-directed learning, formal training, and on-the-job mentorship is what allows me to remain knowledgeable and adaptable in the constantly evolving field of surgical nursing.
How do you deal with a surgical team member who is not following protocol?
In a situation where a surgical team member is not following protocol, my first priority is always patient safety. My approach is to address the issue directly, but calmly and professionally. I would not hesitate to speak up, but I would do so in a way that avoids creating unnecessary conflict or a hostile environment. My initial step would be to calmly and quietly remind the individual of the correct protocol, highlighting its importance. For instance, if I see someone reach across a sterile field, I would immediately and clearly say, "Please avoid reaching across the sterile field to maintain sterility for the patient." This addresses the action without personally attacking the individual. If the behavior persists or if it is a severe breach of safety, I would not hesitate to escalate the issue. My responsibility is to the patient, and that means following the hospital's established chain of command. I would discreetly inform my charge nurse or the surgical unit manager of the situation. I would provide a factual, objective account of what occurred, allowing them to intervene and handle the situation appropriately. I believe that every member of the surgical team has a duty to ensure safety, and sometimes that means holding colleagues accountable. While it can be an uncomfortable position, I am prepared to take it as my commitment to maintaining a safe and sterile environment is unwavering.
Why are you a good fit for this specific or team?
I believe I'm a strong fit for this specific team because my skills and professional philosophy align perfectly with the demands of this department. I have a proven track record of working effectively under pressure and maintaining a calm, focused demeanor in high-stakes situations. My experience in both the scrub and circulator roles has given me a comprehensive understanding of the surgical process from start to finish, which allows me to be a versatile and reliable team member. I'm meticulous in my approach to patient safety, from performing thorough preoperative checks to my unwavering commitment to maintaining a sterile field. I'm also an excellent communicator. I can anticipate a surgeon's needs, speak up clearly when I see a potential issue, and collaborate seamlessly with other team members to ensure a smooth workflow. Beyond my technical skills, I'm a dedicated team player who values mutual respect and open communication. I understand that a successful surgical outcome is a result of everyone working together, and I'm committed to being a positive and supportive presence in the operating room. I'm also a lifelong learner. I stay current on the latest surgical techniques and technologies, and I'm always eager to learn from my more experienced colleagues. This combination of technical proficiency, a strong focus on patient safety, and a collaborative mindset is what makes me confident that I would not only fit in with your team, but also contribute to its continued success. I am ready to bring my dedication and experience to this role.